So you do a lot of bone grafting.
That's correct.
And in what cases do you need bone grafting? And take me through that process.
Okay. You know, Randy, it could be somebody that has lost a tooth, and that tooth has been gone for a really long time. So what happens is the bone literally goes away when that tooth goes away. So, but this is obviously a place where it's key that we place an implant, but you know, no bone, no implants is really what's going on. So we're able to have that person, and really we're having that person grow their own bone back. We're doing some things to help stimulate the body's ability to do that, but at the end of it, we can regenerate, help that patient regenerate their bone, and now we have the ability to place an implant or do something else cosmetic that needs to be done.
So is it artificial bone? I mean, what is it? It's not coming from their hip or anything like that.
You know,
where's
Randy,
this bone coming from?
Yeah, you know, Randy, it can. You know, there's different sources of using bone. We can literally take it from the patient. That's one area. We can use what we call.
But you rarely do that.
Yeah, rarely do that. There's really hardly a need for that anymore. Now we also use what's called cadaver bone. So that's human bone, but it's, you know, it's from somebody else. It's cadaver.
Do you do that a lot?
Yes.
Okay.
Do that a lot. And then there's other types of materials that are, you know, you can use, we call it bovine, we can use cow bone and horse bone and, you know, all kinds of different bone because no matter what bone you use, that bone is going to be replaced by your own bone. So sometimes people think, you know, you're using cadaver bone, you know, they'll turn into somebody else or,
all right.
you know, somebody, you know, because they have somebody else's bone. That bone is only there to serve as kind of a template or a scaffold.
So is it like a stimulator in a way?
Yeah, it does. It stimulates the production of new bone into that area. Yeah, it's a, you know, and Randy, that has really changed the game of what we're able to do for people today with implants.
So people that couldn't get implants before now can do it?
Absolutely, yes.
You say some people are mad, like that they were told elsewhere it couldn't be done.
Right, so somebody will
told me that in the green room. You said they get angry.
Yeah, somebody will come in for a second opinion because, you know, sometimes people get referred to other dentists, and those other dentists are 50 miles away, 100, 150 miles away. So before they go make that trip, they come to our office and they ask about something that they've been told, and I tell them what I know and what I have training in and experience in, and yeah, they get mad. You know, it's like, why didn't this other guy tell me that? And, you know, Randy, we all have different levels of experience and education and training. So all I can say to that, you know, answer that question is, you know, somebody just, you know, honestly just may not have had the training and the education and have experience with that. To, you know, for them, that was the best answer, that was their truth. But you know, there is ways, you know, to do this safely, predictably, and you know, have an outcome that they wouldn't be able to have otherwise.